Medication Administration Unit 1. This is Martha Olson for Introduction to Nursing Concepts for Iowa Lakes Community College. When we look at a medication, we know that it's a substance it's used to help with diagnosis, treatment, cure, relief, or prevention of health problems. Nurses do play an essential role in safe medication preparation, administering the medication, and then finally evaluating the effects of that medication. In all settings, the nurse is responsible for evaluating the effects of meds for the ongoing health status of the patient, to teach the patient and the family about the medication side effects, how to safely take the medication, and then finally evaluate their ability to self-administer those medications at home. Looking at the scientific knowledge base on page 565 in the Potter and Perry, we are looking at medication as far as legality. Many of the concepts we've talked about, the learning the medication classifications as pharmacology. In our medication legislation and standards, the Food and Drug Act was done to help protect patients. It was the first law that was designated to regulate medications, and it simply requires that all medications are free of impure products. In looking at a case study then, we will be following this throughout the classroom as well, but we see an 85-year-old African-American woman who is on skilled care following hip replacement surgery. Our concepts then come with the drugs can have three different names. It has the chemical name, the generic name, and the trade name. Very seldom do nurses know the chemical name. It's usually very long and complex. A generic name would be, an example would be acetaminophen, and then the trade name is very common and usually easier to spell, which would be like Tylenol. In looking at our pharmacology concepts on page 566, it really does talk about the effect of the medication on the body system. We need to know what is the expected effect and what would be an unexpected effect of that medication. And then we will spend great time talking about the liquid, the topical, parenteral, and other forms of how the medications are given to cause that effect on the body. The pharmacokinetics study how the body, or how it enters the body. So we'll talk about the pills. You're going to have a whole unit on IV medications, topical, vaginal, rectal, any body orifice. We can really administer a medication into the body. How it is absorbed and how the body's tissues and organs are affected by the absorption, all the way from pediatrics who tend to absorb medications differently. Patients that have Crohn's disease might absorb through the small intestine much differently. To reach their site of action would be things like blood volume, their albumin level. Is that a medication that's bound to protein? Can be affected by that. Is it metabolized? And then looking at exiting the body. It's usually through the kidneys, and a patient that has poor kidney function is going to possibly be toxic to the medication because they are not able to eliminate that as needed. 4 processes are included when considering the pharmacokinetics: absorption, distribution, metabolism, and the excretion of that medication. Our quick quiz is asking you a question, and as you look at this question, what you want to underline is the word kidney disease, complicated by kidney disease. And then the next thought process that comes as you read this is elimination and toxicity. Our case study continues where we see Esther needs to take many medications, and in that sentence you in your head are thinking polypharmacy and medications that interact with each other because you're taking so many at a time. So we have to understand the medication regimen, and are they able to also afford medications, because many of our people are not able to afford the expensive medications that are ordered, so they simply don't take them. Absorption on page 567 and 568 is looking at that route of administration. Our IV route is the most rapid. You might want to make some note cards that so you can put in order the medication routes and how fast or slow each one works, and put them in the order. And we'll be doing some of that in class as well. The ability to dissolve the medication. Do I have stomach acid issues? Do I take a lot of antacids that might cause the medication to dissolve differently than it was intended? Blood flow to the site of administration. You would not give a topical medication to somebody that has poor blood circulation. Body surface area, we know pediatric body surface area is much larger than the older adult. The small intestine rather than the stomach for absorption, because the small intestine is many meters long versus the stomach, which is not. And then lipid solubility of the medication. When medications interact with one another, we have to ensure that they're not given at the same time. And so that's where you see medications that are given at 8 and again at noon, but different meds at each time. So for the site of administration, look at, do they have an adequate or rich blood supply? Can it be absorbed quickly? We look at factors that alter or impair absorption with other medications. Many medications have to be given on an empty stomach in order for them to be absorbed appropriately. And one of the psych meds that I spend time visiting with students in mental health is Geodon, and that has to be given with at least 500 calories of food in order for it to be absorbed appropriately. Distribution is looking at how it gets to the organ where we want it to exert the effect. The chemical property of the medication, and then the person that takes it, the physiology, again, the circulation, their membrane permeability, will it be allowed in past that membrane into the cell, and then the protein binding is your albumin, your pre-albumin. Older adults that do not eat enough protein and have lower albumin levels or liver function that is altered as a result of aging. The degree to which a medication binds to serum proteins will affect the medication distribution. Most meds bind to albumin to some extent. An unbound or free medication is in its active form and would be absorbed differently. Metabolism on page 568 in the 8th edition of Potter and Perry talks about what will happen to the meds if your organ used for the biotransformation is not functioning correctly. The number one that comes to my mind is the liver. Most of the biotransformation happens in the liver, and if you have a decrease in liver function with aging or cirrhosis of the liver with alcoholism, a medication usually is eliminated more slowly, which results in accumulation and toxicity of that medication. Excretion through the kidney, anybody that has decreased kidney function is at risk for toxicity. So we think of those types of patients, those with renal failure, those that are on dialysis, end-stage diabetics. Our lab values that go with kidney function are your BUN, blood urea nitrogen, your creatinine, specific gravity. The liver, bowels, lungs also have to do with excretion, but not to the extent that we see with the kidneys. Our types of medications are kind of hard to read on this slide, and we will be doing an activity in class, but we look at the therapeutic effect, the adverse effect, idiosyncratic reaction, side effects, toxic effects, and allergic reactions. And in looking at those, we know that the way that they act and their type of action is going to vary considerably. Patients don't always respond the same way, or even with successive doses of medications. It may be their third dose of an antibiotic, but now they have the adverse reaction, which is an unintended, undesirable effect. The medication at that point needs to be de-C'd, and you call the doctor, because life-threatening events can happen with an adverse effect if that medication is given. Side effects that are predictable but often unavoidable secondary effects are produced at the usual therapeutic level. Some are immediate. They will tell you, my airway's closing off, I'm unable to breathe, and other effects may take more time for them to happen. With an allergic reaction, the medication acts as an antigen in the body. It triggers the release of the antibodies in the body, and then the allergy symptoms vary, depend on the type of medication that they have. It might be a little bit of localized itching. It might be all the way to an anaphylactic reaction. These are medication bracelets that patients often will wear to demonstrate to a paramedic or a caregiver that they have an allergy to a medication. With our second quick quick quiz question. We look at this and we underline the word respirations are depressed, and that becomes the key of that stem. Our medication interactions can be either good or bad. Alcohol has a synergistic effect on antihistamines, some of our antidepressants, our barbiturates and narcotics, because alcohol is also a central nervous system depressant, and so that can be a bad effect. A good effect might be a patient with hypertension may need to take a combination of medications, such as a vasodilator and a diuretic to control their blood pressure, and those two medications, being of two different classification systems, work together or synergistically to improve the outcome for that patient with their blood pressure. Our therapeutic range becomes what I call, are they in that level where that medication is going to work at its best? We talk about the doses administered, how long it's therapeutic, or how long its effect is seen in the body. And that, again, can be affected by their blood concentration, by their kidney and liver function. A therapeutic range of a medication occurs between the minimum, where it barely works, and the maximum, where it's almost to the point of toxic concentration. Anticonvulsants are one such drug class where we have to be very therapeutic, and they're often given several times a day in order to, quote, keep the blood level therapeutic. Antiarrhythmic medications might simply be ordered every 6 hours and not QID, which is every 4 times a day, because we need to keep that blood level consistent. Antibiotics also fall into this therapeutic range that becomes very important. And our last slide for this first set is looking at the onset, peak, trough, duration, plateau, and biological half-life. When we look at medications, we know IV administration enters the bloodstream and has a reaction on that body immediately. And so giving an IV medication is of higher risk, because once the medication is there, it's too late. We can't get it back, and we have to react very quickly to any adverse reaction they have. So it depends on their response. Our IV medications that are given in a code blue situation, we hope they work within 30 seconds as we're continuing a CPR. All medications have a biological half-life, which is the time it takes for excretion process to lower the amount of that unchanged medication by half. And that can be affected by many things, but when we look at a medication with a short half-life, we have to give it more often. A medication where we say it has a long half-life, like many of your sleeping pills, your Ativan, your anti-anxiety medications, they have a much longer half-life that can cause problems, especially for the elderly that don't have good function through the liver and the kidney. The half-life does not change no matter how much medication is given. So if I give the medication that has a half-life, if I give twice the dose, it still will have the same amount of half-life left in it. On page 570, it talks about some agencies set schedules for medication administration. However, nurses have to be able to alter that schedule based on knowledge of that medication. An example I would give, a daily medication is your statins that lower cholesterol. It's always given at bedtime because it works best with the function of the liver. The pharmacist may look at that and not remember that it has to be given at bedtime. It's a once-a-day med. They give it at 9 in the morning. So as a nurse, I go in and I confer with the pharmacist and say, this medication needs to be given at this time of day. Many of your medications for GI disorders have to be given on an empty stomach, so we may give that at 6 o'clock in the morning after they have not eaten all night and an hour before breakfast, so that that medication can work on an empty stomach. So look at page 570, because we will have some test questions referring to that. Time-critical medications have to be given within 30 minutes before or after the scheduled med time. Non-critical med times include meds which the timing is not as likely to have an effect or a problem with the medication administration. And so the book kind of distinguishes those two. Some of that depends on the facility and what their policy is. This ends medication administration for Potter and Perry, and this is our part 1. Thank you.